Good afternoon. My name is Dr. John Prescott. I'm the Chief Academic Officer for the Association of American Medical Colleges here in Washington, D.C. And on behalf of the AAMC, I'd like to thank Representatives Allison Schwartz and Dr. Phil Rowe for co-chairing the Congressional Academic Medicine Caucus and for their continued support of our nation's medical schools and teaching hospitals. I would also like to thank Anna Eston and Madeline Pinnell from the Representative Schwartz's office for their logistical help in coordinating today's briefing. There has been a lot of conversation lately about the topic of today's briefing, our nation's severe physician shortage. Unfortunately, one place we've seen the effects of this shortage recently is within the VA system. Today we're going to examine the short and long-term challenges of addressing the physician shortage and how academic medicine community are partners with the VA in healthcare, education, and research. I would like to especially thank all of our speakers here for joining us this afternoon, and in particular Dr. Carolyn Clancy, Interim Undersecretary for Health for the Department of Veterans Affairs. We are very grateful that Dr. Clancy has made the time to join us for this very important conversation. My colleague, Chief Public Policy Officer Dr. Atul Grover, and I will present next, and then we're pleased to welcome Dr. Patrick Burnett, Associate Dean for Graduate Medical Education and Clinical Professor in the Department of Emergency Medicine at Oregon Health and Science University School of Medicine. Now, there are some bio sketches for each of the day's speakers included in the packets that you received, and if you came in and happened to pick up your lunch but not one of those packets, you should get one of those packets. That's the reason, though. A lot of important information in there. And now I'd like to turn this over to Dr. Carolyn Clancy. Dr. Clancy.
Thank you. Well, good afternoon, everyone. I hope I won't disappoint you too much by not having a PowerPoint show, but I can make it up to you another time, perhaps. It is really a terrific day to be here. First of all, for those of you who are visiting, this is truly exceptional weather for the nation's capital. Even if you live here, it's exceptional weather. The other reason it's unique today is that this is the month of July. So for those of you who are wondering why I'm stating the obvious, July is really a big month in graduate medical education. So 35 years ago, I started my medical internship, and you don't need to do a whole lot of math there, but the point is, it is a very scary, exciting, exhilarating, and terrifying month all at once as medical students transition to acting like real doctors with a lot of supervision. I want to be really clear about that. So it is a terrifically great time to be here celebrating the long-standing partnership between the nation's medical schools, as well as other health profession schools, to be sure, and the care of veterans. But this literally goes back to 1946, shortly after the end of World War II, when VA and schools of medicine actually began partnering, and it's been a fantastic partnership since then to give the veteran the highest quality of medical care, of affording veterans the opportunity for postgraduate study, and the policy memo states, which he was compelled to forego in serving his country. These days, of course, we would be updating that to say he or she. And of raising generally the standard of medical practice in the United States. I can't even begin to think about all the things that have changed since 1946. I can certainly tell you that life expectancy in this country has increased dramatically. Not only due to improvements in medical care, but that has certainly been a substantial piece of it. And in fact, that has a lot to do with some of the physician shortages that we're hearing about across the country. Our eyes have been focused, of course, on the case of VA, the fact that we have many more new veterans enrolling, and that is a great thing for us, and we are privileged to have the honor of serving those men and women who effectively wrote a blank check in the service of this country. But in addition to that, we're seeing this throughout the healthcare system, throughout the private sector, at academic centers, and so forth. And really, it does not have as much to do with expanded access to care, which is something really to celebrate. It has a lot to do with demographics. And in fact, a study done with the American Academy of Family Physicians a couple of years ago showed that indeed the shortages of primary care physicians, more people with insurance is a challenge, but the bigger challenge is actually demographics. People living longer with more medical opportunities, living longer to experience the challenges of having chronic illnesses and so forth. So that is something the healthcare system writ large is experiencing, and certainly at this moment for VA, we are experiencing a crisis in access. So I can't tell you how appreciative we are of our academic partners, appreciative but not surprised that they would be stepping up to say, how can we help? Many people are stepping up to say, how can we help? And our commitment to training future physicians in this country continues with full enthusiasm. Let me just be clear that 2/3 of practicing physicians in this country have received some or all of their training in a VA facility. If you think about that, then every July, the footprint grows as more and more medical students graduate from an increased number of medical institutions across the country. And many of my colleagues believe that when we are recruiting physicians, when it's a joint recruitment with an academic affiliate, that attracts a better candidate pool. I don't have a solid evidence base to tell you that, but I am just reflecting the experiences of many of my colleagues. And we know that health professional trainees in multiple disciplines actually contribute substantially to VA's ability to deliver cost-effective, high-quality care for our veterans. So this is really a moment of celebration. We could celebrate every day because it is a long-standing, enduring partnership. For those of you who don't know much about the Veterans Health System, let me just give you a sense of the scale. Our commitment is to serve veterans wherever they are. And that amounts to 152 VA medical centers, 6 independent, of the 152 VA medical centers and 6 independent outpatient clinics, 124 hospitals, and 3 of those independent clinics are affiliated with 130 of the 141 allopathic medical schools and 22 of the 29 osteopathic medical schools. So this isn't just like we're having a little party here in Washington. I mean, this is something that literally has an impact across the entire nation. In addition to that, VA has something like 1,700 points where veterans can access care. In addition, more than 40 other healthcare professions are represented by affiliations with over 1,800 unique colleges and universities. So we know that healthcare is all about the people who provide care, and our commitment to making sure that we are a big part of the continuing graduate and continuing education of the nation's healthcare professionals is vibrant and real. Over 40,000 individual physician residents rotate through our system annually, or about 1/3 of all U.S. residents train in the VA each year. That is a huge number of future physicians and then more future professionals. And as we look to the needs of a 21st century healthcare system, I have to say I'm very pleased to say that many of them are actually getting training in virtual modalities, right? If you think about healthcare, the currency of healthcare, although we think of high-tech gadgets and all of that, and that's all very important, but it's really about information and communication. So that means more and more health professionals, physicians especially, will be providing care by telehealth modalities, by video conferencing. In fact, I would challenge you to Google Video Doc, and you'd be amazed how many businesses are popping up for virtual doctors. Usually they would like your credit card before they tell you a lot about their services, but that is very much going to be the way of the future. And at VA, of course, how this plays out is we almost have 2 large groups of veterans. One is our people who served in World War II and Vietnam and conflicts in between. So a lot of these folks are older. Many are not so interested in virtual modalities, but some are for sure. And then we've got younger cohorts of veterans, increasing proportion of women, many of whom have little patience for a Marcus Welby-like model. They would like to be in touch with us by their smartphones, patient portals, and the like. And about a third of the veterans who receive their health care from the Veterans Health Administration right now actually have their own secure patient health record, also known as My Healthy Vet. So as we look to address, and I do mean every minute of every day, how can we decrease waiting lines and make sure that veterans not only consistently get care that's safe and high quality, but that's also timely. Our partnership with our academic affiliates is more important than ever. So I very much look forward to continued advances in biomedical science, which will mean continued challenges in the shape and nature of the populations that we serve together, but are really, really pleased to join you here today. Thank you very much for your attention. Looking forward to questions.